The Applied Technology for Neuropsychology Lab at the Istituto Auxologico Italiano in Milan is made up of researchers and clinicians interested in exploring the opportunities offered by information and telecommunication technologies. Main goal of the lab is to develop the innovative tools, applications and services for psychology and neuroscience. The Intrepid project is aimed at developing a multi-sensor and virtual reality system for the treatment of specific and generalized anxiety disorders. The innovation of this approach is the combination of virtual reality and biofeedback. The patient is made aware of his reactions, assessed using physiological parameters, through the modifications of some features of the virtual environment in real time. The use of portable devices such as PDA or smartphone allows the patient to perform at home individually and autonomously the same exercise experienced in therapist's office. The overall goal is to anchor the learned protocol in a real-life context, so enhancing the patient's ability to deal with his symptoms. The Intrepid multisensory system is applied and tested on patients affected by generalized anxiety disorder. This psychiatric disorder is characterized by constant and unspecific anxiety that interferes with daily life activities. The aim of the present project is to increase the potential of cognitive behavior therapies and biofeedback techniques using virtual realities in combination with biofeedback instruments to reduce anxiety. Virtual exposure is used to enhance emotional processing of daily life by helping patients to face memories and situations associated with them. Let's see in details the clinical protocol. Each session with therapist, except the first one, starts with a debriefing about the course of symptoms the patient experienced at home during his everyday life and the possible difficulties encountered using mobile device and running the home care scenario. After this step, the patient begins the virtual reality treatment. First of all, he is connected with all the technological devices, including a head-mounted display, joystick and biosensors that record heart rates and skin conductance. At this point, the therapist turns on the biofeedback device and registers for 3 minutes these parameters while the patient is in rest condition. This serves as a baseline in order to compare patient's activation during pre- and post-session. Now the patient can start exploring the virtual environment. The head-mounted display helps him to feel as a part of the environment and thus enhances the sense of presence, the feeling of being inside the simulated experience. Turning his head around, the patient can have a look at the landscape and the images in his visual field change coherently with the head movement, up and down, right and left. The joypad is used to walk forward and backward. The virtual environment is designed as a tropical island facing on the ocean and containing a forest on its internal area. Following the audio narrative, he can explore the island starting from the beach, which is the arrival point reached by a boat. Following a footpath that guides through the forest, one arrives to the start point, where different panels are represented to indicate the direction to go in order to reach the clinical areas. In each of these areas, a relaxing exercise is included. In this training, following indications given by the voice guide, the patient tries to relax himself, while some elements of the virtual environment are directly modified by his physiological parameters recorded on real time. The clinical areas are 4 and the elements of the island triggered by physiological parameters are fire, clouds, waterfall and gazebo. The choice of the clinical area depends on the number of the session the patient is attending. In fact, session 1 and 2 are dedicated to the campfire exercise, in which the narrative induces relaxations of arms and legs. Physiological parameters control the fire intensity. so that the reduction of activation results on reduction of the fire until it goes out. In sessions 3 and 4, the patient performs the exercise related to the clouds and learns to relax the head and the trunk. In sessions 5 and 6, he reaches the waterfall area and, following the narrative, tries to relax all the body parts together. Here, the reduction of the physiological arousal corresponds to a reduction of the stream intensity until the water stops. At the end of the 6th session, the patient has to find some words or images that remind him to stress situations. These items are used to customize the exercise of the gazebo that is performed during the remaining 7 and 8 sessions. In this training, the patient visualizes the item chosen as if it undergoes a stress inoculation program. Applying relaxation techniques learned, the patient experiences a reduction in size, fading or floating of the chosen items, depending on the settings of the customization. Once the clinical exercise has been completed, the therapeutic session goes to the conclusion. Before the patient is disconnected from all the devices, another physiological measurement in rest condition must be run. Comparing these parameters with the ones recorded before the treatment, the therapist should find a reduction of the anxiety indices. In order to empower the acquired results and to gain even more abilities to relax, outside the therapist's office, the treatment is repeated day by day thanks to the home care scenario. It consists of the same virtual environment run on the HTC Pro mobile phone without the head-mounted display and the joystick. At his own home, the patient, at least once a day, spends some time to perform the exercise trained during the last session with the therapist. He connects himself with the biosensors, which are connected via Bluetooth to the phone, and the MP3 player, by which he will listen to the relaxing narrative. At this point, he launches the application on the HTC and starts the session.